Good afternoon. Another episode of Whisper with د.صالحة. Today we are honored to have د.كوثر البوسعيدي. She's a senior consultant physiotherapist and a founder of د.كوثر البوسعيدي Rehabilitation Physiotherapy Center. د.كوثر, she's an icon of physiotherapists in Oman. Welcome to episode of a Whisper with د.صالحة.
Thank you very much. It's my pleasure for you to have me here. Although it's the first time, I'm so happy to be with you.
So, doctor, can you tell me what is the urinary incontinence and why women are more affected more than men?
Okay. First of all, urinary incontinence is a condition which can cause a lot of leakage of the ladies when they are coughing and sneezing. So many people, they don't want to talk about it. A lot of ladies, they feel embarrassing to talk about this condition, and can be caused with a lot of factors. Example, pregnancy, about a chest problem, which is, we call it the chronic of, we can say that like asthma. When you try to cough and sneeze, you can get a leakage. Okay. Those can be caused because your muscles already been weak, the pelvic floor muscles. So it can lead for a lady cannot control when he cough or something. But it's not just only the case of a pelvic floor muscle. And sometimes it's a bladder instability. The bladder cannot hold urine properly. And this is not only because of the age, because nowadays we do have a young generation, they have this problem.
Interesting.
Yeah. Young generation, they can have even urge or stress incontinence. Really, we need to do a research for that. But for me, according to the years of experience, I found that the ladies, the young generation, they keep and hold their bladder full for a long time. They're scared to go to the toilet if it's a public toilet. So whenever I examine this, the ladies who are having incontinence, always is 1 in 3. In every yes, but now it's already been high. Here in Oman, we have almost about 43% of urinary incontinence, according to my research.
What strategies that can be done to reduce the risk?
To reduce, we have awareness. Actually, I do a lot of awareness in the masajid, and always we train the people how to protect the pelvic muscle. But although we do that one, but the people need to be checked. It may be not the pelvic floor muscle.
By who, doctor?
Always we do check it about it, because there is a gynecologist, they can do it, but always physiotherapists, they're the one who can, women health physiotherapists, they know how to examine the patient. When you examine the patient, you need to know about the pelvic floor muscle power. The pelvic floor power is a 0 to 5. So there are some people, they don't feel even the trigger, but they cannot even contract their pelvic muscles. And the other people, the muscles has been spasm.
Right.
So the muscles have been tight, they cannot contract, you need to release it. So it's a 2 different way of examining the patient. Sometimes they say, oh, the muscles are weak. No, sometimes it's not weakness, the muscles are spasm. The people, they don't know.
It could be either spasmodic or even weak.
But you need to examine thoroughly. And can be stress. Stress can be due to the intra-abdominal pressure when you cough. So you have sphincter mechanism, the pelvic muscle cannot hold. So it will be open it up. And sometimes it's urge. The urge incontinence, sometimes they call it as a bladder instability. People, when their bladder is full, they won't be able to reach in the toilet. So they can wait their underwears. It can be a few drops, and sometimes can go until to their thighs, or can wait their underwears. So you can see that is a very embarrassing case.
There are any treatment that you do, and what you as an icon of physiotherapy in Oman, what's the role of physiotherapists here?
Actually, here we do have many physiotherapists in Royal Hospital and University Hospital, also the whole hospital. We have my colleagues, even in Rustak and Snau. I train some of my colleagues in Snau. We are doing that. You need to examine the patient first. You need to listen to them first. Some of them will say, I don't have incontinence, but when you dig and then you ask them, they will come. You need to examine. After the examination, then you need to get a treatment plan. Some of them, if they have a grade 3 muscle, train them about the bladder, about the pelvic muscle, rehabilitation. Some of them, they don't have muscle power, so you need to start to stimulate the muscle. You stimulate the muscle until becoming strong, and then you train them to do the pelvic floor muscle exercise. In the old time, they used to call Kegel exercise, but for me, I'm saying that it's a pelvic floor muscle exercise, because Kegel, when he did that one, it was in 1948, but now it's already been in advance. Okay, there is an exercise you need to stimulate first, then you need to train them about pelvic floor exercise, active pelvic floor exercise, and then there is resisted exercise, which is a weight. Ladies can use a weight, like you're going to the gym and using the weight. So there is a weight for the
for pelvis as
yes.
well.
Yeah.
So it is a stages that the treatment takes stages to.
Yes, treatment stages, and always people they're coming from far away. I don't see them in the same day, because I explain to them what will happen and whatever, and I say, okay, go and think about it, and then you can come. Because some of them they don't want to come daily. Sometimes they case in it daily. Some of them they are from far. They will not be able to come. Some of them they cannot afford to pay. But in our clinic, anyone who cannot afford to pay, we do see them because we want them to go to pray.
What the message do you want to tell those who suffer silently?
What I would like to tell them that do not suffer in silence. Please ask for the help. Go and see your physiotherapist or your doctors. So ask for the help. If there is something we can't do it as a physiotherapist, so they refer you to the urologist or urogynecologist. But at the end, we want you to come up and just prove yourself that you can get better and you can do the exercises, because the exercise is more important for you, and you need to be examined and to get treated if you have a problem.
Thank you so much for that message, and I think it's very serious for me. I look into probably this underdiagnosed also, Doctor.
Yes, it is. It's a misdiagnosed, and people they take it as a cultural that is normal. If they go and ask their family, they will say that, oh, this is normal after the children, if you deliver the children. But no, if you delivered a child, the first child, you started with your exercising after Arba'in, and then people, they'll train you properly. Of course, you will not have this one. It can be prevention. But if you don't do it, you still waiting for many children you have, then you'll get the problem. Okay, but it's not just only this one, but menopause also. Hormone changes. Okay, hormone changes, and then can make the people they're having the urge incontinence. I remember last year I got a lady who's 86 years old from Edem, and that lady was coming to us, was wearing pampers, and alhamdulillah, after 2 weeks, then he stopped wearing the pampers.
So we were saying it is treatable?
Yes, it is. If Allah subhanahu wa ta'ala is before saying yes, it's me, but it's Allah subhanahu wa ta'ala, yes, we can treat that one according to the techniques what you are using.
Right.
Yeah, and we can prevent actually. More awareness, we can prevent.
So prevention is, apart from awareness, what ladies can do?
Always, if I'm giving the lecture and then I ask them, I said, okay, if anyone want to be checked, they can come and we can check them. Always I give them some free consultation. We can examine them. If they have a problem, I say, okay, you need to be treated. They don't have a problem, I said, okay, go and do these exercises. Yeah, but it's according to the examination, because you cannot tell them, go and do the exercises. Most of them, they are doing wrong. They are trying to put their tummy in, or the glutes muscle, and they think that they're doing pelvic floor muscle exercises, which they are doing wrong.
Yeah. Probably they will worsen the condition, or they make it worse.
Some of them, yes, and some of them they have a long, they strain their muscles well because they have a constipation, so they make the muscles weaker. And people, they think also, oh, I delivered with cesarean, I don't have this problem. No, they do have, because when we are pregnant, the muscles becoming stretched.
d.كوثر, what is your public message concerning urinary incontinence? What do you want to tell them through this podcast, Whisper with the Doctor?
What I would like to say that, first of all, we can talk to our colleague, the doctors, to detect it very early and to send the patient to the proper channel. And the secondly, to the people, for the population, if you have this problem, do not hesitate. Contact anyone, ask about it, so you'll be guided to get a treatment.
So the physiotherapy as essential part of treatment, and for me, I can hear that your effort, and you need to be each patients with the urinary incontinence, even fecal incontinence, need to be assessed by physiotherapists as well.
Yes,
right?
the doctor, the gynecologist or urogynecology, after the examination, they can send to us. And again, if I'm not wrong, I remember last 2 months, I was having antenatal class, treating the ladies with the pregnancy, and among 6 ladies, 5 of them, they were having incontinence. So those 5 ladies should be followed after delivery to see if it will stop or they need a treatment.
Right.
Because it may stop and then it will come back. But if you already detected while they're pregnant they have this incontinence, so we should follow up with them after Arba'in, so we can train them the proper examination and can see what was the cause of that incontinence. But people, they keep and ignore. They say, oh, it's because of pregnancy.
Because of pressure to the
Yeah,
bladder.
but even if they are putting the pressure on the bladder, but why not everyone? If it's normal, why not all ladies who are pregnant they have incontinence?
That's the message.
Yeah.
Absolutely.
So it means if when they are doing the antenatal clinic, I hope that the doctor can ask them about this issue. Do you have incontinence? If they have incontinence, we should follow up with them and tell them, okay, after Arba'in, go and see so on and so on, or come and see, we can see that. But they ignore it. Ignorance for that one make it worse, and they come and take long time for getting a treatment.